Gina Basham, and this is a presentation on the use of role-playing in partial fulfillment class N5309, Teaching and Learning Strategies in Nursing at UTA Arlington College of Nursing. Role-playing is an effective teaching strategy to assist students in therapeutic communication. It allows them the opportunity to walk in someone else's shoes and helps them gain perspective. Role-playing includes three different stages. So a briefing stage, which includes the discussion of the learning objectives. The second stage is the running stage, which is where the students actually do the role-playing and the participants act out the scenario. And then the last stage is the debriefing stage, where we're reviewing and analyzing the experience to see what was learned and if there's different strategies that could be used. We will demonstrate the use of role-playing in teaching and error prevention strategy. This is a technique that can be used to help a team member prevent a patient safety event. With over 98,000 patient deaths occurring every year related to medical errors, it's important that we prevent these in healthcare delivery. One of the tools that we can use is called ARC, A-R-C-C. The A stands for ask a question. So if you find yourself in a situation where there potentially is a patient safety event, we say use this tool and start out with the A of ask a question. This is kind of a hope and hint stage where you're hoping to get the person's attention to keep them from performing an error or having a patient safety event occur. If you can't get their attention with that and they're continuing with their behavior, then you're going to do the R of ARC, which is request a change. And with that, again, you're prompting and asking, couldn't you do something different, maybe to change the outcome of this situation. If they're continuing to ignore or continuing on with their behavior, then you're going to move to the C of ARC, which is to voice a concern. And using the words, I have a concern, is a safety phrase that we teach so everyone knows that when someone says, I have a concern, we stop and look at the situation to see if there is something we need to do different, look at all of our options so that way we can continue moving forward in a safe manner. If they're still not heeding to those calls, then you need to follow through with the next C, which is follow the chain of command. And that's where you're going to get a supervisor, a charge nurse, one of your managers to ensure that we can stop this before it becomes a huge patient safety error. So just to review, ARC is an effective tool to use to communicate with a team member when you are concerned about a situation that could lead to a patient safety event. ARCC, ask a question, request a change, voice a concern, and follow your chain of command. So now we're going to do the role play, and what I want to do is give you a scenario, a patient scenario, and then you use ARC to act that out and see how that would work in that situation. So this is Dalton and Hannah. We're going to do, the situation is going to include a nurse and a tech. So the situation is that you walk into a patient's room to start out the morning, to do your morning assessment, hand over the breakfast tray, those kind of things. And then you notice that the patient's armband is not on the patient, but it's laying in the bed. So Dalton, as a tech, how would you address that using ARC?
Hey, I noticed the patient's armband is falling off. Shouldn't it be on the patient?
Yes, I noticed that, but I'll put it back on later.
Don't you think it would be more beneficial to the patient to have their wristband?
Yes, I think that is very important. But Sally's mom called me and she's next door and she really needs her pain medicine right now, so I'll put it back on when I get back from Sally's room.
I really think the patient should have their wristband. I will get you a new one.
I really don't know why this is such a big deal. I mean, I can just put it back on when I get back from giving Sally her pain medication.
I'm really concerned that the patient may get the wrong medicine, food, or lab.
Well, I just don't have time right now, so I'll have to do it later.
Okay, I'll get the charge nurse.
Okay, great. So you can see how from the tech and the nurse perspective, sometimes it's difficult to start those conversations, and this is a way to just kind of, like Dalton did, ask that first question to get the attention of the person and then to know, okay, she is busy, there's things going on, so how do I continue to help her understand that there's a safety event that may occur if we continue on this path. So do you feel like this would be a good tool to use to be able to communicate in difficult situations?
Yes.
Okay. Do you feel like that this tool could also be used in other situations to help communicate in a difficult area when you're having a hard time communicating with someone, or maybe communicating a difficult task at the time?
Yes.
Okay, perfect. Okay, well, I appreciate y'all's time, and you did a great job. Thank you.